Ellen?
Well, good morning, and thank all of you for coming out so early, especially those who are not East Siders. We are so happy that you've joined us today to share suggestions and insight about the divorce process. As a clinical psychologist in private practice, I work with many couples and families experiencing the challenges of the divorce journey. This is very unfamiliar territory to most and can feel rather intimidating and quite overwhelming. Dealing with the financial, the parental, the legal, and the health issues is an extraordinary learning curve. Experiencing the detachment from a marital partner is often laced with contentiousness and adversarial conflict, as well as anger. It is also not unusual to experience depression, low self-esteem, social withdrawal, and loneliness, as the transition to single life can be rather daunting. As Holly has mentioned, there are physical symptoms as well that can be very common to someone who is about to encounter the divorce process. Weight loss, insomnia, increased alcohol intake are just a few of the symptoms that we may see in our psychology office. Many may also use the divorce process to work out conflicts experienced during the marriage. One of the reasons divorces can be so prolonged and intense is due to mutual blame for hurts and disappointments that occurred even very early on in the marriage. People's memories during divorce seem to be very long. These old hurts provide ongoing fuel during the heated discussions about what each partner deserves and feels entitled to. More time with the kids, money, artwork, big screen TVs, furniture, custody of the dogs, microwave ovens, etc., etc. It seems that through the divorce process, with all this anger, items that really didn't have very much importance a few weeks ago suddenly become the top priority item on the must-have list. The desire to have a personally fair resolution to compensate for all the pain the partner has created perpetuates what can be an enduring and bitter process. Custody evaluations can be particularly destructive if clients have abandoned reason and good judgment. Pursuing an outcome where one spouse gets everything and the other spouse suffers and gets nothing may keep the process, as Barbara knows, going on and on and on, which can be expensive emotionally, from a health perspective as well, and financially devastating. All of us on this panel believe there are other more cooperative approaches which can help to minimize the contentiousness. My role with clients as a clinical psychologist is to guide my clients and their children through all the emotional gates and help them keep a healthy perspective, which hopefully, believe it or not, will include productive communication with the spouse. We also focus on a positive emotional adjustment so that the client can eventually feel a sense of personal wholeness with reduced focus upon blaming. Ending a marriage may be the correct decision, but also creates a sense of loss, which may initially result in insecurity and difficulty setting future goals. Therapy is an excellent forum in which to address many of these issues and develop coping mechanisms and find ways to find self-support. My respected colleagues also endorse strategies, as you have heard, to create and encourage a smoother and healthier divorce path. Divorce does not have to be so ugly. Divorce can be painful, but my professional work over the last 37 years has repeatedly demonstrated that with proper knowledge and support, one can successfully master the challenges in anticipation of a healthy and hopeful post-divorce adjustment. We so look forward to your questions. And as you're thinking about the questions that you would like to ask us, I would like you to consider some questions for yourself. If you're someone who's considering divorce, or you have a loved one who's considering divorce, or you are an advisor to someone considering divorce. If you're experiencing marital conflict, I would ask the person going through the process, have you and your spouse discussed the issues and tried to problem solve? Another question, what needs do you want your spouse to address to promote harmony? What behavioral changes can you make to add to his or her satisfaction? Are you being angry and impulsive in deciding divorce? Or have you carefully considered the pros and cons in an informed manner? Have you considered the interests of your children? Another question, which I know Barbara advises her clients to think about all the time, is a separation a strategic opportunity to step back objectively and assess the strengths and weaknesses of your relationship? Have you and your partner participated in individual and/or couples counseling before, during, and after the divorce process? Because actually, after divorce is often when couples need the psychological support the most. Are you current with visits to your primary care and specialty physicians throughout the divorce process, as your medical status can be compromised due to the ongoing stress? And finally, have you thoroughly researched attorneys who specialize in collaborative divorce and traditional divorce? These are all important questions to consider as you encounter the process. I thank you, and we look forward to your questions.